There's a couple more tests that we need to do with the wrist, maybe with overuse injuries or even with trauma. One of the tests that we want to do is for stenosing tenosynovitis, dequer veins, and that's where you have your extensor pollicis brevis and your abductor pollicis longus. They come through here. The tendons, they come right through this anatomical snuff box. And so what we want to do is we want to stress those. And as those tendons are passing through their sheaths, sometimes there's irritation within that sheath, and that's why they call it tenosynovitis. And remember, I told you guys, I want you to remember, those sheaths are not always lined with synovium. Sometimes they're lined with fat. And so the catchphrase now is peritendinitis. Now, what we're going to do is we're going to just have the patient go like this, and then we're going to have them stretch those out. And we'll see if it causes them any pain along this anatomical snuff box. If that doesn't, then we're going to passively do it because we can do it further. Now, a lot of people will have pain and tenderness when they're doing this, but if they actually have the problem, it'll be a lot worse. Another one that we're going to test, and this is someone's had trauma maybe with a child, some type of a supracondylar fracture, or something that's putting pressure on the median nerve, and we're going to be testing the anterior intraossei branch of that median nerve. And so we're going to have the patient see if they can just make an OK sign, just like this. And if they can't do that, then it'll come out just like this. There you go. And that tells us that they're having some type of a problem with that nerve. And usually when it's transient, whenever the pressure comes off of that nerve, it'll go away. But that's anterior intraossei syndrome. They cannot make the OK sign, like this. Another one is we're going to look for trauma in the wrist. If they've had any type of a fracture in the wrist, then we're going to do what's called the carpal lift test. Now, what we'll do with the carpal lift test is you have to have the patient put their hand down on a flat surface onto a table, just like this. So I'm going to pretend that Blair's wrist is on a table, and now it's on the table, and I'm going to come down here, and I am going to put pressure right down here on the patient's hand to hold it stable. Then what I'm going to do is have her extend each one of her digits against resistance and see if she can lift them off of the table. While I'm adding resistance, that's going to cause, if there's a fracture down in the carpals, it'll cause a pinpoint pain right at that level. So the patient's hand's flat on the surface. I'm going to stabilize it, and I'm going to have them extend their fingers.